Hey there. Thank you for joining us. I'm Mike Trim, the morning anchor for WPTV News Channel 5. Maybe you're joining us on your lunch break. Maybe you're just taking a time out where you can join us on our Facebook Live because we have a very important topic we're talking about today. It is all things related COVID-19. We're talking about case count, vaccines, your Thanksgiving plans, hospitalizations, and it won't be just us talking here at WPTV. We are also bringing in two experts, Dr. Luis Pena, he is a pulmonologist, and Dr. Ramprasad Gopalan, he is an infectious disease specialist, answering your questions today. So if you're watching this right now on the WPTV Facebook page, we want you to get in the comments and we will do our best to answer some of them and really get some good information out there and kind of clear the air when it comes to this ever-changing topic that we not only report on the news, but you're hearing when you're out and about, and definitely in hospitals and facilities, just like these two doctors have seen firsthand. So I do want to introduce first Dr. Ramprasad Gopalan, infectious disease specialist, and like I said, Dr. Luis Pena, a pulmonologist. Thank you for joining us, gentlemen.
Thank you for having us.
We have seen a rapid case increase for coronavirus cases, not only around the country, but here locally. No place has been spared here in the Palm Beaches and Treasure Coast. When you see that, and people see that the numbers jump so high, what is causing the spike in these COVID-19 cases? And Dr. Gopalan, if you'd like to answer first, please.
This is the most important question, which is dogging us right now. The spike, in my opinion, came in from laxity of us by not minding masks, social distancing, because we became a little lax. And also we opened up a lot of facilities, indoor, outdoors. Those contributed to our current cases right this minute. Again, we don't have to have the lockdown had we followed a proper, simple principles, because wearing a mask, washing your hand, keeping your distance will still work. I mean, even with vaccine, because we talk in future, still need to follow those common, simple, basic principle. I think, why we are not doing that, there are many causes. And in my view, virus doesn't know right, left, center. It is a virus. It'll affect everybody equally. So having a hand washing technique, wearing a mask, social distancing, those are
and thank you. And Dr. Pena, I want you to add in on that too. I mean, as a pulmonologist dealing with the respiratory system and your expertise, are you seeing the same thing? This is so touchy of a disease that, if we go back just slightly to the way we were before the pandemic, this is actually what's causing it. Do you agree with that?
Yes, Mike, I think we've reached a point of pandemic fatigue to a degree. I think people have been eager and ready to start going back to their normal lives if there is, and then reach a sense of normalcy. But that process has also been associated with, exposure to others, to more risk for, crowds of people. Some people are still learning how to use their masks properly. Like Dr. Gopalan says, hand washing is a big thing. It seems like we have, as a society, to ingrain it in our brain that there are some simple rules of survival that we have to start following from here on. If we touch a handle of a door in a common place or of a bathroom, we have to wash our hands, we have to put hand sanitizer, things like that. So unfortunately, there is a delicate balance between reopening the economy and the world we live in. People are eager to work, and that is a good thing. But at the same time, we cannot go too much to the extreme of exposing ourselves to this health problem.
Gotcha. And I am going to get to a question here in one moment from Mr. John Connor. But I do want to say we're going to get to the vaccine questions. We're going to get to more questions as well. Let me get to one question right now. If you're joining us on our WPTV Facebook page, you can get in the comments section. And John asks, and if we could answer him, he just got a COVID-19 test positive. What do you do next after that? I mean, some might think, oh my gosh, this is an instant hospitalization. Some might think, so what? The truth probably lies somewhere in the middle generally. So from the doctor's perspective, Gopalan, what should John do first right now?
Hey, John, there are, not knowing your complete medical history, majority of the patients who are positive stay home and they will be fine. That's from the beginning of the pandemic to now, that is still the same. Now, things to watch for: fever, shortness of breath. I would suggest, spending $30, $40 and getting a pulse oximeter online and just monitor your pulse ox. It'll tell you if you're 99, 99, all of a sudden you start seeing 94, 93, 92, please get to the ER immediately. Those are very minority of the population, but having a vigilance and check with your doctor, keep in constant contact, and having notify them of any symptom changes. But if you're having high fever, shortness of breath, or anything which you cannot manage at home, please do go to the ER, notify them that you are positive prior to arrival so they can triage you effectively.
Dr. Pena, let me add on to that question, and great answer, Dr. Gopalan, thank you. The first time around, if you will, when we did do lockdowns and shutdowns to an extent here in the state of Florida, it was to stop or to flatten the curve, and it was to prevent a massive onslaught at hospitals that hospitals wouldn't be able to handle with their staff. Too many COVID patients, not enough staff. It seems we did flatten the curve at some point this year. When we did that, we did reopen to a certain extent, but we are seeing the cases again. To get people to buy in on that again, perhaps some people are thinking, well, we already did that. We flattened the curve. What are you guys seeing firsthand right now that says something to the contrary? Are the hospitals not properly staffed yet again with this high COVID count?
I think the hospitals have had a significant amount of time to set contingency plans in place. I don't think we are at the point where we were back in March. There has been already experience from our end, from the developers of different medications. The vaccines are in the works. So I don't think we are exactly where we were back in March. However, there is a limitation in resources that it's always going to be there, because unfortunately we live in a society that is prepared to fully accommodate a significant portion of the population at the same time in the hospital. And it's not only a matter of the amount of ventilators, it's a matter of the logistics in general. Medications, we run out of medications on a routine basis, even before COVID-19 appeared. So we need to understand that as a society, we have to exercise caution, and we have to exercise some sort of discipline and awareness so we can all together go through this in a more smooth way. We don't want to find ourselves in the situation where our grandma, ourselves, our family needs an intensive care unit bed and there is none available. And we've been in situations in different parts of the world where we've almost been there.
Thank you, Dr. Pena. Dr. Gopalan, I want to ask you, we do have a viewer question, and if you're just joining us on your lunch break or wherever you are on the WPTV Facebook page, please ask a question in the comments. We'll try to get them to our two doctors right here. Nelda Hawks wants to know, do I need to go to a family Thanksgiving? I have COPD and lung problems. I mean, these are people like Nelda that have some underlying health issues that I think they have some genuine concerns this holiday season, Dr. Gopalan.
Correct. Starting with your prior questions, how are we seeing the hospital beds and the situation of fatigue for caregivers and, the healthcare providers? There was 4 or 5 weeks ago, very few patients in the hospital. And there were few hospitals where they had closed the entire COVID units. Now we are back to the spike level. So that shows that yes, our intervention before had helped and we flattened the curve. And now, since we got out of that, we need to do something to make sure we are flattening it again till the vaccines and everything take effect. Number two, asking a specific question about the, the person with the COPD. First thing is you got to evaluate where you're going. Are you going to a gathering where there are people, 50, 60 people in there? You don't know what, where they've been, depends what kind of exposure they have. So, no, first thing is doing that. And number two is evaluating your own risk. If you are not 100%, and if you're in COPD, you're having exacerbations, I think it is safe to skip this year. I know it is hard to say that, but if nothing is more important than you per se. So your health will carry you through many, many more Thanksgiving than putting it right there. The problem is a lot of people are having we don't know who is going to be. Yeah, I think, sorry, Tom disturbed. A lot of people having the notion that, it's just the flu.
Right.
No, it is not. The problem is I cannot predict a 18-year-old who had a mortality, and I've sent a 99, 100-year-old home with multiple comorbidities. So there are a lot more factors we're learning why certain people behave the way they behave. So,
right. It's kind of learning on the fly, I would assume. Absolutely, absolutely.
Smart and simple answer is stay safe. If you don't know where, be home.
Gotcha. Staying vigilant for sure during these times, and it's times where, we've already seen before the end of the year. Take the Sandy lighting tree in West Palm Beach for a local reference. There's usually a huge crowd for the tree lighting. Things like that have been, just outright canceled, and we're even seeing some events canceled into next year. But then we have a glimmer of hope for some. We have a vaccine on the horizon. Two companies, Pfizer and Moderna, have said that they have vaccines that are above a 90% success rate. To the average person sitting at home watching our newscast, that sounds great. Let's get it fired up. Let's get it out there. Dr. Pena, I'll start with you. What do people need to know about that? And it seems like it happened in a rather quicker manner than a normal vaccine would be approved. Talk to that if you could, please.
There has been an incredible amount of scientific research and resources allocated to this. And yes, we are almost about to see the release of commercially available vaccines in record time. People need to know that those vaccines are not going to work immediately. The immune system is going to take a certain time. It's still yet to be determined how long. I'm thinking it's going to be a few weeks, probably around 4 weeks. Some of the studies that are ongoing, they measure antibodies, start measuring antibodies at about 4 weeks. But the point is, you cannot have that false sense of security and then you go to your gathering tomorrow. On the other hand, people are commonly concerned and have been over the years about side effects from vaccines. I don't think there is any question in my mind, but people need to understand that the risk of having COVID-19 is probably going to be much higher than the risk of the side effects of the vaccines. There is still information that is being obtained as of what type of side effects these are going to be. There is definitely going to be some sort of side effects. There is no perfect vaccine or drug for that matter out there that is not going to have, reported potential side effects. But on the other hand, it is important to acknowledge that there are some populations that are going to get more benefit from these vaccines. And of course, the people who are considered high risk, depending on age, comorbidities, their occupations, healthcare workers could be there, and people who work with public in general. But also other individuals like people who have immunosuppressions, etc., that need to be, taken into consideration. So there is a lot of education in the community. The patients are already asking on a regular basis, and there is a lot of interest actually to get this vaccine. And I think vaccines are going to be groundbreaking in the sense that once we have them in place and they are implemented, I think a lot of the activities that are currently on hold are going to start being able to be carried out with a little more laxity. But I don't want to communicate a false sense of security just yet, because I think it's a little too early for that.
Right. And Dr. Gopalan, would you agree on that? Could you please speak to vaccines specifically, how this one really, I mean, I don't know if it's a record time. I don't know the records of every vaccine of how it was made, but one would think, hearing from our newscast and the information that's publicly out there, that, you know, this came through in rather quick order. Should people be wary, and what should people know about the specific coronavirus vaccine?
Okay. Now, for all the people who think we're going to get the vaccine and we return to normalcy, or whatever the normalcy was prior to arrival of this disease, it's not going to happen in any time soon. Here is why. Because there are many nuances of how this vaccine work and how they produce immunity. You know, this vaccine, the two vaccines, what we have heard, you know, the BioNTech, that's from Pfizer, and Moderna, there's something called mRNA vaccine. Now, they prevent you from acquiring disease. But now, there is another part, scientifically, what we call sterilizing immunity. What it means, when you acquire the disease, will you have the virus propagating subsequently? This is a very important question for us to stop the disease transmission. Yes, these vaccines, what we hear, are effective in you not getting the disease. You know, 90 to 95%, you will not get the disease. But as we know, some of the vaccines that are effective in preventing the disease for you, but still you will have the viral particles shedding, which will infect other people. So now, having said that, this is a very important step in acquiring a break in the transmission. So I would hope, you know, we acquired, you know, these vaccines. These are not the only two vaccines. We have host of new vaccines which are out there, which are in different phases, and they work in different ways. You know, these two work in the same fashion, something called mRNA vaccine, but there are many others work in a different parts of the virus and way to form different antibodies. So people need to know, vaccine doesn't mean you can return back to normalcy. And as Dr. Pena was explaining, the timing of you developing immunity. And, you know, the side effects, so far, what I've heard and looked through the studies, it has been mild in the study. But you got to understand, as with any study, the number of people who are in the study is very minute to have a statistical significance. But when we put it to population, the effects amplify. So we got to watch.
Thank you, doctors. And no, we just have you for not forever here, maybe a couple of more minutes. I did want to get one more viewer question on our WPTV Facebook page. Deb asked, and this is a good question about, you know, exactly who can receive this. Deb says, will the vaccine be generally safe for people with autoimmune disease? I think you kind of touched on that, Dr. Pena, but are there people that won't be able to get this vaccine even if it's available?
The data available so far does not contemplate special populations like individuals with autoimmune diseases, like being contraindicated. But like Dr. Gopalan said, we're going to have to watch the data over time, because there are, in every study, there are subgroup analyses that are carried out as the number of individuals enrolled increase. So we will be able to answer those questions with much more accuracy. But so far, that has not been a concern or a consideration.
Okay, very nice. Well, we appreciate your time. We know you both are busy doctors. It's kind of went faster than some viewers would maybe like, because we have so many questions on this. We can count on you guys throughout this to possibly give us some answers in the future, correct?
Yes.
Absolutely. Thank you.
Please stay safe,
All right.
wear your mask, and stay with safe distance, please.
Okay. And a last word, Dr. Pena, for you?
Yes, We just have to, if we do things right, I think we're all going to end up with the benefits in our families, in our community, in our society.
Doctors, thank you so much for joining us, and thank you for joining us on this WPTV Facebook Live. Let's keep the conversation going. Get in the comments section and have a discussion back and forth on what everyone is talking about with these rising cases and everything related to COVID-19.